Welcome back to Those Millennial Pediatricians. I'm Dr. Aniksha.
And I'm Dr. Deshna.
And today we're giving you another episode in our ER Playbook Series where we talk about different illnesses or reasons you might visit the ER, when it's appropriate to be in the ER, when it's appropriate to stay home, and everything in between. So today we're going to talk about an illness that's been going around quite a bit, at least in my clinic. Deshna, I'm sure you've been seeing it a lot.
Yes.
But we're going to talk about Croup today. And when I first heard about Croup in med school, I thought the P was silent. So I went around going like, Le Croup. And everyone was like, it's literally Croup. So,
like, relax.
I think my attendings thought I was really cute and funny for that. And I was like, no, I thought it was
Wait, why don't I know about this?
Oh, it's French, it's le cru, and they were like, stop like hawking up a loogie when you say cru.
Where did you hear this?
Nowhere. I thought it's like cru, and they're like,
that's so funny.
But anyway,
that's funny.
This is a really common reason why kids end up in the ER, and it especially happens at nighttime. It's like 1 or 2 a.m. You're like, what do we do? Our child looks like they're trying to die on us. It's horrible. And so this is a very common scenario where like your toddler will wake up and it sounds like they're struggling to breathe and you're not quite sure what to do. So we'll kind of go over Croup a little bit.
So let's go into a little bit of what Croup actually is. So do you know what the official term for Croup is?
No. What do you mean?
No. Okay. I got asked this by an attending once on rounds and I had no idea. So that's why
Clearly no one ever asked me.
But it's laryngotracheobronchitis.
Oh, yeah. You're right.
Which basically is a fancy word for inflammation of the larynx, which is the voice box, the trachea, which is the windpipe, and inflammation of the bronchioles. So that's what Croup is. And basically it's a viral illness. It causes swelling below or at or below the vocal cords, and it's typically caused by parainfluenza. That is a type of virus, but really any virus can cause it, but this is typically the most common one. And that swelling or that inflammation is what causes that barky cough, like a seal-like barky cough, and the noisy breathing. And we see this most usually in the ages between 6 months and 5 years, so a little bit younger. And it usually peaks in fall and winter. And the reason it sounds so scary, like that bark-like cough, is because of the narrow airways and all that swelling, and that causes turbulent airflow through like a narrow pipe.
So let's talk a little bit about what Croup sounds and looks like. So I am not going to attempt the barking cough because I've tried before and it does not.
Yeah, it does not. Like, I don't know if we're ready for that today.
I just sound like I'm coughing, but basically it sounds like a barking seal-like cough. And so it's so funny, like parents really understand that once they hear it. So if you ever have to hear it in your child, you will understand the difference between a barky cough or a seal-like cough versus a regular cough. So it often starts with that. Sometimes they'll kind of have like a hoarse, raspy voice. And then the thing that we really see that's kind of like the hallmark of Croup is something called stridor. And so it's kind of this high-pitched noise when you're breathing in, again, because of that swelling that Deshna mentioned and like kind of the turbulence that's happening. So oftentimes you'll hear it when they get kind of agitated or upset, but sometimes when they're calm, you'll kind of hear like this when they're breathing in. And so they'll kind of cry and they'll go, and they'll go, and you'll kind of keep hearing that over and over again. And again, it's usually what wakes them up at night. And so you might hear this more at nighttime. And then sometimes during the day, they're actually feeling a little bit better. Again, this is not actually the same as wheezing. So this is kind of that upper airway swelling, whereas wheezing is more lower airway. And wheezing is more, you hear it when you're breathing out. Sometimes you hear it when you're breathing in too, but it's more of a lower pitched kind of sound because it's lower in those kind of smaller airways. But oftentimes we'll get parents who come in who say they hear a wheezing sound. And so oftentimes you'll hear your pediatrician say, was it breathing in? Was it breathing out? Do you notice it when they're crying only or upset only or when they're calm? Things like that. And oftentimes we'll see kids who come into the ER, though actually you think they're wheezing and sometimes it sounds like wheezing. You give them a treatment, which we'll talk about in a little bit. It doesn't really do anything. And then you give them the treatment for Croup and that's when they turn around. And so sometimes those sounds can really overlap very closely. But again, the distinction there is that we often hear it when they're crying or upset, but not when they're calm. If we do hear it when they're calm, this distinction helps us guide treatment and whether they need to be given a specific kind of treatment, which we'll talk about, whether they need to be admitted to the hospital, so on and so forth.
So let's say your child was just diagnosed with croup. Your pediatrician told you that your child has croup, or you listen to this episode and days later your kid has that barky cough.
Happy to serve.
What do you do? Yeah, happy to serve. So this is what you're going to do if you're at home. So number one, we already kind of talked about this. It sounds really scary when they're coughing and have that inspiratory, that stridor or that noisy breathing. But the most important thing to do is stay calm, because the more upset they see you, the more upset they may become, and that often makes the breathing worse. You're going to want to sit them upright, because that gravity, that positioning will help. The cool night air, or opening a freezer and letting them breathe in that cool air very briefly, will significantly help. And we can go into a little bit of why. So why does this help? So exposing your child to cold air constricts the blood vessels as a reflex, and that directly reduces airway swelling and allows air to flow less turbulently through that inflamed trachea. And that you'll see kind of a almost immediate reduction in that kind of noisy stridor when you do that. And comfort is better than forcing fluids. So Tylenol, Motrin, again, that cool air will really do wonders. We don't really recommend, I kind of already talked about it, but Tylenol and Motrin if they have fever. Albuterol, if you have a nebulizer at home, it does not help croup. I think I want to emphasize that very highly, because there's a common misconception. Albuterol will not help, because this has nothing to do with your bronchioles or those pockets at the end of your lungs. It has nothing to do with that being inflamed. It's more upper airway stuff. So albuterol does not do much. And there are certain treatments that do help, which are steroids and rack epi. In most cases, and Anisha, correct me if I'm mistaken, but steroids is generally they do give that if there is evidence of stridor, and rack epi is really for severe cases of croup, like when there is that noisy breathing, regardless of whether they're crying or not. So that's kind of like the more severe treatment, and typically that means they need to stay in the hospital to be monitored.
And this is one of those scenarios compared to like reactive airway or asthma, where a steroid inhaler is not really going to help you, because again, it's that upper swelling. So that's why like an oral systemic steroid or like an injected steroid is really going to be the mainstay of treatment here before we even jump to like a breathing treatment, because that's really what helps more than like giving your like fluticasone or something like that. So that's kind of the difference between asthma again too, is you can't just give them like an inhaler or a spray. It doesn't work.
Yeah. In most cases, when you have a general common cold, I talk about steam bath and steam showers all the time. This is the one case when steaming anything will not help. Neither will throat sprays, and you definitely do not want to force coughing, because that can make the symptoms a lot worse.
Let's talk a little bit about when it's okay to watch at home, and then when you have to go in and who to see depending on where you have to go. So when it's okay to watch at home is if they have that cough is going to happen, but their breathing is clearly comfortable. You don't see them working really hard to breathe. If they do have stridor, if the stridor is only when they're crying or agitated, again, like Desha mentioned, you can just use that cold air to kind of help them through. And then if they're drinking fluids, if they're improving with calming measures, all those other things as well, they're not having any other concerning symptoms, no signs of dehydration, you're good to continue watching at home. Now, if any of that starts to happen, then you kind of need to seek care. So most likely, usually a lot of urgent cares kind of have steroids and breathing treatments and things like that, but sometimes you do need to go to the ER as well. And so for reasons to seek care would be if they're having any stridor at rest, that means you need to go and be seen immediately. And that would mean that either they get just a steroid, or sometimes that means they get a steroid and a breathing treatment. And so typically we do give both just to help them out. Especially at the ER, if they get a breathing treatment, they do need to be observed for a few hours before you can go home, because they need to see if you need another breathing treatment. And the key there is if you need 2 breathing treatments, then you are going to be admitted because you might need more than that. And so you need to be watched for that reason. Other reasons to be seen would be, if you notice they're having any difficulty breathing, so you're seeing their lungs pop out, or sorry, not their lungs, wow. You're seeing their ribs stick out, or you're seeing their neck suck in, or you're seeing their nostrils flaring. Those are signs that they're working really hard to breathe. If they're breathing really fast or their breathing looks labored, obviously if they're having any color changes like blue lips or anything like that, you're obviously going to go to the ER. If they seem like they're much more sleepier or much more fussier than usual, or again, if your gut just says they don't look right. Now, if they have like stridor at rest overnight and then all of a sudden it kind of gets better for the rest of the evening and they're not doing it for too long, that's a reason where you could kind of see their pediatrician the next day. So if things aren't really persistent, then and they get better and you don't kind of see that happening again, you can see your pediatrician the next day. So it's not like a few seconds of stridor at rest means you have to rush over there. But again, if things are persistent and they're not getting better, or they're certainly getting worse, or they're having color changes, working really hard to breathe, those are reasons to kind of see urgent care, ER, all those things. And then special populations. So again, babies are always special. They're always high risk. So especially babies less than 6 months, you should definitely go be seen. And then if they have any history of airway issues, if they've had surgery, if they have other airway problems already that predispose them to having more difficulty, those would be reasons to go ahead and be seen as well.
Okay, so let's say you are taking your child to the ER because their stridor won't stop and they're very agitated and just overall look unwell. So this is what will typically happen in the ER. Just to set expectations, we kind of talked about the couple of medications they can give. So most likely they will get a steroid. Typically it's dexamethasone. And the point of that medication is to really reduce the swelling in the airway. The same way that I talked about cold air reducing swelling, steroid is often the quicker onset or more effective way to reduce that swelling in the airway. The second medication, which is typically reserved for more moderate to severe cases, is racemic epinephrine. And at this point, if they do get that, there will be an observation period in the ER. They'll typically monitor for a couple of hours. If the stridor is better and you no longer have it at rest, most kids go home the same night. If it recurs or it becomes worse, that typically requires an admission to the hospital. A hospital admission is quite rare, but I have seen it happen where they just do not respond as well to the racemic epinephrine as we hoped, and they need a couple more doses before they are stable for discharge.
No, I mean, I've even seen admissions that are very uneventful. Like we're just observing them overnight. You don't need any more. The next morning, it's like, cool, dope.
Even just for OBS. Just to be safe.
Just to make sure they're okay, because the worst thing that can happen is you guys go home and then they need another treatment and things like that. And we don't really, that's kind of the reason we don't just give you the same way we'll give you albuterol to take home in a nebulizer, even though it's a type of breathing treatment. We don't give you that to take home, because if things worse or change or things like that, that's not something you can manage at home. That really is something we need to make sure that we watch them in the hospital, because there have been maybe like 1 or 2 times where the kid needs racemic epi, doesn't change, and then they just kind of keep needing it over and over, and then they kind of need to be watched in the ICU. I think we went over some of these already, but just to kind of re-summarize some of the myths that we've talked about and then introduce a couple of new ones. So again, croup is usually not dangerous, but very important to keep a close eye on. And then hearing like a wheezing noise, again, that doesn't always mean wheezing. So sometimes that can mean stridor. So keeping a close eye on whether you're hearing it in versus out, whether they have a history of croup, and then obviously seeing a physician or talking to a physician can help you kind of discern between the two. It can always come back after a few nights. So if you think that they just got better in day 1, day 2, remember it is caused by some sort of a virus. And so the virus can kind of increase and worsen over the first few days of illness. And so if it seems to go away in a couple of days and then kind of comes back after a day, that's still within the realm of normal. So you can expect that sometimes. And then, of course, with any viral illness, antibiotics do not help. So giving any sort of antibiotics really is not going to make any of this better. And then again, that cough can kind of linger. So even if we take care of the stridor, it's not going to always take care of that cough. So you can also expect that cough to kind of continue. So steroids do not take away your child's like barky cough, merely more that swelling more than anything else.
Yeah, it can take a couple weeks at least for the cough to kind of completely go away on its own. All right, so in summary, croup is really loud and scary, but typically manageable at home. But of course, we're always here for all those medications that we talked about. Remember that calm kids breathe better. So the more calm you are, the more calm they will be, and the more easily they will breathe. Utilize that freezer, that air in the freezer, that will also do wonders. And obviously, it goes without saying, trust your instincts, so you're never wrong to seek help if you're truly worried. And with that, I hope this episode was helpful. Save this episode for that middle of the night, can I go to the ER concern, and we'll be releasing several more ER Playbook for Parents episodes in the next several weeks.
With that, we'll see you at our next episode. Thanks for
Take
listening.
care. Bye.
Bye.